Ever imagine yourself in a career where every single second counts, like you're on the edge of your seat? Today, we're diving into the world of clinical perfusion scientists, and this role catcher guide you sent is, well, intense.
It's a demanding field, that's for sure. Not for the faint of heart.
No kidding. The precision, the quick thinking, it's like they're orchestrating a symphony inside the human body, and the stakes are, well, life and death.
That's a pretty good analogy. They are responsible for keeping a patient's blood flowing and their lungs working during some really delicate surgeries, like open heart surgery, for example.
Wow, so they're like the heart and lungs outside the body. That's incredible.
You got it. They operate this, get this, heart-lung machine, connects the patient before surgery even starts.
Oh, wow. So they're involved from the very beginning.
Yeah, it's crucial. They're monitoring everything, vital signs, the whole 9 yards, and they have to communicate all those changes to the surgical team constantly. Basically, they make sure the patient's body can actually survive the entire surgery.
That's a huge responsibility. Talk about pressure.
Tell me about it. This RoleCatcher guide really doesn't sugarcoat the demanding work environment, the long hours, the potential for emergencies. It's a lot.
Yeah, I noticed they're pretty upfront about that. But it's interesting because they also talk about how, like, despite all that, there's this incredibly high job satisfaction rate among perfusionists.
Right. And you know what? It makes sense when you think about it. They're making a real tangible difference in people's lives right there in the moment.
Yeah, that's got to be incredibly rewarding.
Absolutely.
And it's not just, I don't know, the emotional reward, right? The role catcher guide talks about how intellectually stimulating this field is, how much constant learning is involved.
Oh, absolutely.
Ah,
This isn't a career where you just learn everything in school and then coast. The technology is constantly advancing. There are always new procedures and techniques.
you've got to be someone who actually enjoys, like, being on the cutting edge, always pushing the boundaries.
Exactly. You need that drive to keep learning, keep improving.
Okay, so let's say someone listening is thinking, this sounds amazing. How do I even become a clinical perfusion scientist? Where do they even begin?
Well, like a lot of specialized medical fields, it starts with a solid foundation. We're talking a bachelor's degree, and not just any degree either.
Yeah.
You'll need a strong background in science, so biology, chemistry, maybe even physics.
Makes sense. You're basically working with the circulatory system, so a deep understanding of how the body works is, well, crucial.
Exactly. You've got to know your stuff inside and out. Then, on top of that bachelor's degree, you're looking at a specialized perfusion program.
Okay, so those exist, like specific programs just for this.
Oh yeah, they're out there. They're usually about 2 years long, really dive deep into cardiovascular physiology, pharmacology, the nitty-gritty. And of course, you're learning all about the heart-lung machine, how to operate it, troubleshoot it, everything.
And I'm assuming there's a lot of hands-on experience built into these programs.
Oh, absolutely. You'll be doing clinical rotations, working in actual operating rooms alongside experienced perfusionists.
So it's like you're not just learning the theory, you're actually getting your hands dirty, so to speak.
Exactly. It's intense, but it's the best way to learn.
So you've got your bachelor's, you've gone through this rigorous 2-year program. You're basically an expert, right? What's next?
Well, not so fast. Just like with doctors and nurses, you need to be certified. In the U.S., it's the American Board of Cardiovascular Perfusion, or ABCP.
Right. Got to make sure you're legit.
Yeah.
So you pass this big exam, and then boom, you're officially a clinical perfusion scientist.
Pretty much. Although, it's not like you stop learning once you're certified. This field is constantly evolving, so you're always reading up on the latest research, new technologies, that kind of thing.
Right. It's like a lifelong commitment to being a student, in a way.
You could say that.
So the role catcher guide also mentioned professional organizations. Are those important for perfusionists?
Definitely. Joining something like the American Society of Extracorporeal Technology, AMSECT for short, is a great way to stay updated on everything.
So it's like networking, but also professional development.
Exactly. Plus, you can attend conferences, hear about the latest research. It's invaluable.
Okay, so let's talk about actually landing a job in this field. The role catcher guide had some interesting insights on interviews, especially about those competency-based questions. Those always trip me up.
They can be tricky. It's not just about what you know. It's about how you've actually used your knowledge in real-life situations.
Right, like they're always asking you to tell a story, right? Describe a time when you faced a challenge or how you demonstrated a specific skill. It's like, how am I supposed to remember all that on the spot?
It's about being prepared.
Yeah.
The RoleCatcher guy had some good advice on that, like actually taking the time to think back on your experiences, identifying those key moments that really showcase your abilities.
So you're almost creating like a, I don't know, a mental library of stories you can pull from.
Exactly. And not just remembering the story, but thinking about how it relates to the skills they're looking for. Like, okay, maybe you had this situation where the heart-lung machine started acting up during a procedure.
Oh gosh, I can't even imagine. Talk about pressure.
Right. But instead of panicking, you kept your cool, you troubleshooted the problem,
Yeah.
maybe even came up with a creative solution on the spot. That's the kind of story that's really going to make you stand out in an interview.
Okay, so it's about showcasing your ability to handle the pressure, the quick thinking, all those things we talked about earlier.
Absolutely. It's one thing to know the theory, but they want to see that you can actually apply it when it really counts. And, speaking of standing out, the RoleCatcher guide also talked about their own tools for job seekers. And I got to say, some of those features are pretty impressive, like that RoleCatcher.capture thing. Have you had a chance to check that out?
Yeah, the browser plugin, right? It sounds like a lifesaver for anyone who's ever had to like wrangle a million different job postings.
Tell me about it. It's like you're on all these different job boards, and it's so easy to lose track of things. But this plugin, it lets you save everything to your RoleCatcher account with just one click.
Yeah.
No more copying and pasting or trying to remember where you saw that one promising lead.
Right, because who has time for that when you're like knee deep in a job search?
Exactly. It's all about making the process as streamlined and efficient as possible.
And then there's that whole AI feedback thing for interview practice that seems, I don't know, almost futuristic.
It's pretty wild, right? It's like having a personal coach, but instead of a real person, it's this AI that analyzes your responses, your pacing, everything.
So it's like you record yourself answering interview questions, and then this AI tells you how you're doing.
Exactly. It can even pick up on things like, oh, maybe you're using too many filler words or you're speaking too quickly. And then it gives you personalized feedback on how to improve.
Wow, that's incredible. It's like having a secret weapon to help you ace those interviews.
That's the idea. And let's be real, in a competitive job market like this, anything you can do to get yourself an edge is huge.
Absolutely. Well, I'd say we've covered a lot of ground today. For anyone listening who might be feeling inspired, maybe even a little overwhelmed, any final thoughts on what it really takes to thrive in this field?
It boils down to passion. You got to love science, you got to be fascinated by the heart, and you have to be driven by this desire to make a real difference in people's lives. It's not an easy path, but it's one of the most rewarding careers out there, no doubt about it.
Couldn't have said it better myself. This has been an incredible deep dive into the world of clinical perfusion science. It's demanding, it's challenging, but ultimately incredibly rewarding. A huge thanks to our expert for shedding light on this fascinating field, and to you, our listeners, for joining us. If you're interested in learning more, be sure to check out the RoleCatcher resources we mentioned. They've got everything you need to explore this career path further. And who knows, maybe you'll be the one saving lives in the operating room someday. Until next time, keep exploring, keep asking questions, and keep diving deep.